The DSM-5 defines child sexual abuse as any sexual act involving a child that is intended to provide sexual gratification to a parent, caregiver, or other individual who has responsibility for the child. Sexual abuse includes activities such as fondling a child's genitals, penetration, incest, rape, sodomy, and indecent exposure. Sexual abuse also includes non-contact exploitation of a child by a parent or caregiver, for example, tricking, forcing, enticing, threatening, or pressuring a child to participate in acts for the sexual gratification of others without direct physical contact between child and abuser. Overall, sexual abuse is unwanted sexual activity with perpetrators using force, making threats, or taking advantage of a victim in any way so that they are not able to give consent. Many people do not accept that male children get sexually abused. This is grossly incorrect. In our practice alone, we've dealt with an alarming amount of cases where adult males were sexually abused as children, and this affects them still today. Child victimization, including childhood sexual abuse, is considered an important factor in the development of several psychiatric disorders or symptoms in both childhood and adulthood. Among adolescents, commonly reported consequences include sexual dissatisfaction, promiscuity, and an increased risk of re-victimization, which is when the abused becomes the abuser. Also, research has shown us that someone who is sexually abused can oppositely develop an age-inappropriate sense of over-responsibility. This is where the abused becomes the caregiver. Depression and suicidal behavior or ideation are also more common in sexually abused patients compared to non-abused patients, which shows us that something is going on. The offender may swear the child to secrecy and say that if they tell, then something bad will happen. Sexual abuse is usually accompanied by coercion, bribery, or threats. The child is afraid to tell because of what the consequences might be. For example, punishment, blame, abandonment, or just not being believed. Children in this situation often feel that they have no control over their own lives, let alone over their own bodies. They feel that they have no choices available to them at all. The child knows something is wrong and blames him or herself and not the offender. The offender will often encourage the child to feel that the abuse is his or her fault and that he or she is the bad person. The offender often makes the child feel responsible for keeping the abuse a secret. Sometimes the child also feels responsible for keeping the family together, and the burden of this responsibility interferes with their experiencing a normal childhood. This ties back to becoming a caregiver, where the child has an overdeveloped sense of responsibility. Victims of sexual abuse feel different from other children. They must usually be secretive. This even isolates them from non-offending parents and brothers and sisters. Children feel betrayed because they are dependent upon adults for nurturing and protection, and the offender is someone who they should be able to love and trust. They may also feel betrayed by a non-offending parent who they feel has failed to protect them. Not surprisingly, this is one of the strongest feelings which many children have about their sexual assault. Children may feel anger against the perpetrator and also against others who they feel failed to protect them. Children may feel grief due to a sense of loss, especially if the perpetrator was loved and trusted by the child. These can be like nightmares which happen while the child is awake. They are a re-experience of the sexual assault, and the child may experience all the feelings again which they felt at the time of the abuse. Depression, anxiety, and trouble sleeping are common amongst people who've been molested, even into their adult years. A low self-esteem is almost always a given, along with the potential for damaged goods syndrome, where the victim develops a negative body image due to self-blame. Key markers to look out for are any form of destructive behavior towards themselves or suicide attempts which may reflect this negative belief system. The abused can start to dissociate from the abuse, trying not to feel as terrible as what they do. They can also isolate themselves from their peers as they feel not good enough, and they feel that if anyone were to get too close to them, then that person would find out, and then their lives would be over. Also common are panic attacks, an underlying sense of guilt, anger or loss, as well as sexual difficulties such as a fear of sex or intimacy, indiscriminate multiple sexual partners, or even difficulty in reaching orgasm. Relationship problems such as an inability to trust, poor social skills, or a reluctance to disclose details about themselves become the norm and the only way of life that the victims know. More subtle symptoms can also appear for victims as they grow up and have children of their own, such as the fear of being a bad parent. They can also develop the fear of abusing their own child or being overprotective to the point of where they hurt the child that they're trying to protect. If you suspect that a child is being abused or find out that a child is being molested, it is critical to take any steps necessary to stop the abuse immediately. In fact, you have a legal obligation to report this to the authorities, which comes far second to the ethical obligation that you have to protect that child. Equally as important, that child, the victim, needs to be taken to get professional help as soon as possible. Trust the professional that is treating the child once you've done a due diligence on that professional and have confirmed that they're in fact qualified to treat the victim of the abuse. Lastly, be open with the child. Do not try and protect them from what has happened. It is the covering up of the wound that makes it fester. Open the wound up, deal with it, and help the victim to heal. If you are an adult and you were sexually abused when you were small, then the same needs to happen. You need help. These wounds, no matter how painful they are, need to be opened up and cleaned out so that what happened to you will no longer have any control over your life. There is always help available.